the Unstuck podcast. I am producer Elizabeth Dennis with psychologist Dr. Cynthia Fincher.
Hello, Elizabeth.
Our topic today is the unexpected.
Our focus today is on the unexpected because things that are unexpected is one of the most difficult areas for folks who are neurodiverse or on the autism spectrum to cope with and to adapt to. Many folks that are on the spectrum tend to plan carefully, they prepare, they have a strong understanding of what's coming. And so when the situation is different, when the unexpected occurs, that is often a point of meltdown. And by identifying what is typical, what's expected, and how it's different, we can help people adjust to a lot of different situations. I like to talk about a technique I call state and switch. This is based on the old sales expression of bait and switch. State and switch is where we start with stating what is expected, which is helping people to feel grounded. For example, you may say to a young child, usually your teacher is Mrs. Smith. So that's what is expected. And then we're going to explain why something is different, why there is a switch. So for example, but today you're going to have a substitute teacher named Mrs. Jones because Mrs. Smith is sick. So Mrs. Jones is going to teach today. Mrs. Smith will come back again tomorrow. We're allowing someone to make an adjustment that things are different, but it's okay. It's safe that it's different. It's not a crisis or emergency. We all get this on our phones when we have some kind of GPS map, and the map may tell us to go a different way because of those red lines. And basically the map is saying normally you would take this route, but today, because there's construction or accident or weather, we're going to take a different route. And so if we know why there's a change, that often helps people to make a big adjust to something that's very unexpected. Most parents with children are trying to have a consistent, predictable routine, which of course is important, but you can't make life completely predictable and routine. Things are going to happen that are unexpected. And usually someone with neurodiversity on the autism spectrum, what they are most interested in is understanding the why. So when you can explain the why, that can allow someone to really be unstuck, because a lot of people can get stuck when it's different than expected, and that can be paralyzing anxiety instead of being able to make a transition. So the first part of state and switch, state is to say what is expected, what is normally expected, and the switch is going to say why it needs to be different and how it's going to be different. This can also come in some very adult circumstances. I worked with a woman whose husband was a biomedical researcher, but he had a medical condition that was getting increasingly serious. And she had concerns that when he was bad, that he would be so busy arguing with her about whether or not she could call an ambulance. She was very concerned about how to handle it. And she came up with an incredible state and switch. She basically said, I know that you are the biomedical researcher, but I'm not a medical person and I'm scared. I want to call an ambulance right now. And he agreed to that. And so they were able to move forward. Instead of having a point of conflict where the stakes were high, they were able to make a change. You may have this where a child is expecting to wear a certain outfit. Maybe they have a favorite t-shirt, but if that t-shirt is dirty, here's why we have to do that differently. And again, we might say, look, I'll wash it while you're in school today, and then you can have your favorite t-shirt again tomorrow.
This has been the Unstuck podcast, and today we talked about the unexpected. Thank you so much for watching. Stay tuned for the next episode.